Hello, and welcome to the Introduction to Integrative Symptoms Management, Module 7, Integrating Western and Eastern Treatment Modalities. In this module, we are going to be exploring integrative nursing at the community and system level in symptom management. We are defining the role of the community nurse, the mental health nurse, the elder care nurse, and many other practitioners out in the community. We know that more patients are aware of CAM, complementary or alternative modalities, and are demanding these healing modalities be available to them. CAM can be very cost-effective, it can lead to higher levels of patient satisfaction, it can provide optimal reimbursement, and an increase in nurse retention. You will discover as you read about this that it is truly a win-win situation for the nurses and the patient. So for the discussion this week, you will help your colleagues expand their knowledge of evidence for integrative therapies by sharing the table of evidence you submitted in Module 6. As you can see here, you'll find a gallery section on the discussion board. You'll copy and paste your table of evidence and summary to that discussion board, and then you're going to give a scholarly response to two colleagues, obviously engaging in scholarly dialogue. From two different people. So you're going to comment on two original posts of two different people. Now I put in here comment on one choice of therapy. This is not very clear and I apologize, and I'll fix this the next round. But what I want to say is that I want you to really try to find different types of therapy to comment on, so it can expand your knowledge and library of references for more types of therapy. So your first assignment is going to be the integrative nursing approach to symptom management. I want you to start this assignment by listening to the Healing Touch video created by Arizona Public Media. The link will be on your content page. It shares with you the program Integrative Touch for Kids that is used at Banner University Medical Center in Tucson, Arizona. Healing Touch is an integrative therapy used in a variety of settings. A healing touch will give you an example of symptom management quite different from what we all learned in nursing school. Then you're going to choose a symptom of your interest from the list below: pain, anxiety, depression, fatigue, sleep disturbance, or stress. And you can choose a patient population of your choice. Again, you need to choose the symptom from the list provided here, but you can choose the patient population that you want to connect it to. So you're going to use the template provided. And you're going to remember, as you did with your holistic assessment, that the patient is more than the diagnosis. First off, you're going to describe the pathology of the symptom in your chosen population, addressing body, mind, and spirit dimensions. Again, remember back what you did in your holistic assessment. In that summary, you're going to continue by integrating rationale for your assessment from literature that you have found in physiology, pathophysiology, psychology, sociology, spirituality, culture, any research that you can find that will help you address this particular symptom. Then you're going to outline general patient-centered SMART goals for the management of the symptom. You're going to have a total of 3 SMART goals. 3 SMART goals. That's all you need to put in there. 1 for body, 1 for mind, 1 for spirit. Again, 3 goals: 1 for body, 1 for mind, 1 for spirit. So remember that SMART goals need to be specific. They need to be focused to the client. For example, the client will perform deep breathing twice a day. It needs to be measurable. You need to have something to quantify. For example, the client's systolic blood pressure will be less than 160 in 2 days. It needs to be attainable. Avoid ambiguous statements like will be able to. You want to be clear and specific. For example, on the day of heart surgery, the client will demonstrate relief of anxiety by stating that all their questions have been answered. And here's the most important part of your goal, the realistic component. This will include the patient's support systems, their emotional and physical condition, the level of intelligence, their health values, and their availability to be away from the workforce or in the workforce, and equipment. So here's where you really are doing your integrative nursing work, because you really have to listen to the patient to understand what they can really do and cannot do. Because just pushing out goals to them in a format that they could never attain is going to be not worth your time or their time. And you want to put a time limit on whatever the goal that you're setting. For example, you're going to reduce fever within the baseline of 35.5 degrees Celsius by giving as-needed antipyretic medication and performing tepid sponge baths every 4 hours for 10 minutes. If you need more help with setting up a SMART goal, we've included a link on the content page to another YouTube video called Nursing Education, Setting SMART Goals. Then you're going to use the tiered integrated treatment modality, and you're going to find that explained to you at the top of your template. This is where you're going to describe a comprehensive approach to management of symptoms using the tiered approach of evidence-informed interventions. Find these tiers in your textbook in the individual chapters of the symptom you have chosen. So make this easy for yourself. That's where you'll find your tiers within the specific chapter of the symptom that you have chosen in your template. Complete the template provided to outline information for tiers 1 through 4 using integrative therapies and tier 5 using one pharmacological therapy. This follows the integrative approach of starting treatment from least invasive to most invasive. Include evidence for each of those interventions in the tier using systematic reviews, review articles, clinical practice guidelines, research, etc. Your template allows for one intervention at each tier, so do not repeat tiers. In other words, do not have tier 1 and then another tier 1. You want to have you want to use a different therapy for each tier. Then you're going to discuss your ideas for implementation of an integrative approach to symptom management as a leader in healthcare. Here you can really be helped by reading your textbook, Chapter 15 by Debbie Ringdahl. She gives you a lot of good information here that can help you formulate that implementation that you would like to see as a leader. So the summary of submissions for Module 7 are to first submit by Thursday to the gallery your table of evidence and summary. So you're going to copy and paste your table of evidence and summary to the discussion board, and then you're going to respond to two different colleagues in the gallery. So the copy and paste of your table of evidence is due Thursday, and then your responses are due by Sunday. Submit the assessment, Integrative Nursing Approach to Symptom Management paper by Sunday. So you have 1 week to go. So I'd like you all to take a big inhale, hold, and exhale. Be sure to post any questions to the Ask the Professor board, and I'll talk to you next week. Peace, everybody.